Hi, good morning, everybody. Thank you very much for joining us to, wait, sorry, let me press one more button. This is Instagram button. Okay. Hi, everybody. Now we are basically able to do some webinar today. Actually, today is a really important webinar. Let me show you why. The reason is because that a lot of people don't realize, well, they say, I have diabetic, how I related myself to cancer. And actually, I was surprised after I gave the first lecture showing you that diabetes actually has many potential actual connection with cancer. So everybody tend to be asking a lot of questions. They send me thank you message. They say, wow, I'm so glad you gave me this information, alert me. So I thought that there's a need to really alert everybody that, wow, cancer can be a really something you need to start watching. It's not something that you can say, wow, I'm just diabetic. I don't have to worry about other stuff. But nevertheless, if you are continuing to be a pretty serious diabetes, the chances of you to getting cancer of the various type, which is highly related to cancer, can be a potential issue for you. So that's why I thought it's so important. We now provide you additional information, what type of cancer a diabetic most likely will get. And so you can be understand, and then you can able to watch out for it. And that might be really a good life-saving thing for you. Let me show you why. Cancer, one thing is nowadays, it's not you get cancer, you have a death sentence. Absolutely is not. I can assure you, this is not the case. But the key for cancer is you get early identification, understand whether what stage are you in, and then you start getting treatment. Rather, you wait for, get yourself to stage 4, where cancers are spreading everywhere, then the chances of survival is definitely limited. So that's why this lecture or the webinar is so helpful for many people. And that's why I get so many really good comments regarding why Andrew is so good that you provide at least this information for us. So that way, I could able to alert myself if I'm diabetic, what other things I need to watch for. And maybe that's actually that is the reason why I'm now going to generate a whole series or lecture related to if your blood sugar continue to be high, what type of cancer will come out, and what are you going to look for, and how are you going to prevent that. And the key is get your early identification. You know, where you find your cancer is stage 1, you are good shape. You will get treated either by surgery, whatever. You were able to remove the cancer and you live for a long time. And that's my whole objective. So thank you very much for joining us, Thomas. Tommy, can you give me a 1 if you hear me good? And that way we can know that you can see me good. And people from Facebook, can you give me a like? You can, so I know you can hear it good. And also Instagram, can you give me some with a heart or so we will know that you can actually hear. Because we now have a lot of people come from Instagram, we have a lot of people come from Facebook, we have a lot of people come from Zoom, so it's all multi-level now. So we're gonna start our program, okay? So we're gonna start off by going here, and then let's share the screen here, and then we'll go from there. Okay, so our today topic is really going to be a very important topic, so you can able to start understanding why we want to do all this stuff. Because with understanding, then you can able to really at the end of the day start preparing your all the issue that you might able to face. So that way you can able to start prevention exercise and so forth. And that's why the whole concept, why we want to do all that. And that result, you want to, start understanding, the type of risk you have or who the person that will have. And I'm going to tell you a story later on why I'm really doing this too. This is a real human story. I have a patient that is, with blood sugar is high, her blood sugar is now 11. So, and I brought her blood sugar down to 7 and lower. Now, the thing is that she will never think about herself as cancers, but her age is there, 60 something years old. And I said, hey, have you really do some kind of, GI exam, do a colonoscopy? So what's that? I said, well, when you're a certain age, you need to start looking at that, and especially understand his father has, cancer and colon before. I said, you might be a high risk person. So lucky she listened, and she went to have a colonoscopy, and they found a polyps, and a polyps actually is cancer. And that result, when she removed the polyps and actually right away got surgery removed, she's still stage 1. Now, really with that, if she had not done anything, I tell you, she had no sign and symptoms. She had no stomach ache, no pain whatsoever. Everything is the same. I just alert her to say, hey, maybe she got a colonoscopy. And she listened, and that cancer did not continue to develop to do stage 2, 3, 4, and she might be really not survive. So she is very grateful. She said, Andrew, I'm so glad you actually told me to go do this, colonoscopy, and now I can be basically healthy for many years to go. So you really, at the end of the day, if you have not done a colonoscopy when you are 50 years old, you need to actually start looking at the doctor and say, hey, can we do one? Even you're 30 or 40, if your family has some kind of history of colon cancer or whatever, then you got to do. And this is a real story which you can potentially save your life when you do that. And that is really important. And you don't want to really risk yourself to basically because of, don't go check up. So very important, you have to basically do all these checkups. So now we're going to start going to go with a, lecture now, so you got better understand what we do, okay? So that's what we're going to do now, okay? So we're going that. So today agenda is very simple. We're going to talk about what is the introduction of what is the colon cancer, understand how diabetic and colorectomy cancer related, understand the link, and then we'll talk about how impact this link is going to be and how you can prevent this occurrence. And it's really important how to prevent occurrence is by, lifestyle changes. And I will tell you more about that, and you'll be very easy to understand. Sorry, I'm just going to expand this a little bit more. Okay, good. So net result, you can easy to understand why, you need to act and able to help you to prevent all these potential life-threatening cancer for you. And so we have a prevention strategy for you and how those shooters can help you. So we had a pretty good program. I think today you're going to have a better understanding what is colon cancer. Now, first, we have to understand what diabetic. And I know in my group here, there's a lot of people names. I don't know who they are. They're from United States, Canada, Saudi Asia, Hong Kong. There are quite a few of those. So I want to still go through the 4 stage of diabetic, how you get from 0 diabetic to diabetes. Go through 4 stages. The first stage is your LDL cholesterol goes up. It actually damaged the B cell. B cell coming from the pancreas, takes sugar to the cells that damage. More B cell come out, it still don't work, and the blood sugar to go up. Now, the problem will start. You get LDL cholesterol, the sugar mixed together, the blood become thick. When they become thick, you will form plaques everywhere on all the vessel walls. Now, when that happens, that will be kind of sad because then you very quickly move to stage 2 because you got plaques form everywhere, and then the blood pressure is going to start going up. And this is the real issue for all diabetes because of the fact that it will form plaques everywhere, to your brain, to your kidney, to your heart. And if you don't control that, is 10 years from that, you're going to have a serious complication. So your sugar content goes up. Eventually, you move to the stage 3, which is pre-diabetic. Now, every doctor will measure the same thing on pre-diabetic. It's your A1C, which is the hemoglobin cells, blood cells which carry oxygen to the whole body. They measure the percent of glucose or the blood sugar percentage attached your hemoglobin. So that's why they call HbA1c. Now, when you have the hemoglobin 5.7 or lower, you're a normal person. If you're 5.7 to 6.4, you are pre-diabetic. So with the pre-diabetic stage, the doctor will tell you, hey, you know, Mr. Lau, you are now pre-diabetic. You got to really watch your lifestyle change, eat, diet, exercise. But unfortunately, majority of people will not know. And really at that time, there's no medication. Low sugar tea can really start helping you to lower your blood sugar, move you back to the normal 5.7 stage. You can actually do that. Plus, if you start changing all your lifestyle, you will be basically never go to diabetes. Now, if you don't do anything, the sad part is in 2 to 3 years, you might start changing to what? Actual diabetic. Because once you're over 6.4, you are diabetes. And a lot of people don't understand, and they will continue the same life because no motivated change. Then they become diabetes, and that result, they will have all kind of problems. Now that's why I want to drink low sugar tea. Basically, low sugar is not a drug; it's just a food. It is a supplement food. There are two things in there. There's guava leaves, which is blocking the sugar entering into the gut vessels. And the bitter melon, which is increase the insulin sensitivity, so they take the sugar into the cell. The good thing is they can excess sugar and also cholesterol and also salt. They will dump it out on the urine. Once salt dumped out, then your blood pressure is going to come down. So you will detox, you will get rid of the sugar, get rid of cholesterol, you get rid of the salt, and your blood pressure will come down. So it's a really great product. Now, the good thing is that we don't just ask you, oh, go drink low sugar, this it. We have a program that teach you about how to control your diet, give you a low carb diet, low fat diet. How do you do that? How to exercise, go 6,000 to 10,000 steps a day. You control your weight, lower your BMI from 30 or 233. We have teach you all that. We have hundreds of YouTube lectures can teach you how to do that. And every week we give a free webinar. Our objective is to holding your hand throughout this diabetic journey. Now, the reason is that majority of us, if you don't change your lifestyle, you need somebody to continue to motivate you, teach you, answer questions. Then you can able to change your lifestyle. And once you really successful change your lifestyle, you know what? That will be wonderful because you will continue to live very healthy. Well, 3 high are continue below, and you won't get to pre-diabetic or diabetes. And that is our really objective. So imagine if you can able to lower your 3 high, you can be healthy, you live for a long, long period of time. Now, if you don't do that, you know what can happen? You have all kind of problems because your complication will be risk of stroke, diabetic coma, dementia. That's a very sad thing. I'm sure you have some auntie and uncle keep asking you the same thing. Like, have you had dinner yet for the last 5, 10 minutes, 15, 20 times? You might say, what the hell you're doing, man? You keep asking them the same question. They don't remember because the sugar is just plugged to the brain. You can't get into the memory, so they don't know. Plus, they might have diabetic glaucoma, cataract, can't see, blur. Imagine that. I've engineered 40 somewhat years old. The eye become blurred, cannot see. The whole life can be ruined, you know? So then you have high blood pressure. Then you can got stroke. Now, the worst thing is a lot of that people don't even know you are going to have nerve damage and coronary artery disease. Because with nerve damage, you cannot feel. So things got injured, you don't know, then you're going to get gangrene, then end up you cut off your foot. And you because the blood sugar is too high, you damage your diabetic, your kidney, so you have diabetic nephropathy. So you end up 70% of the diabetic patient get kidney disease. And if you get down to kidney get 30% function, you need a dialysis. You got to go to hospital every 3 times a week. Or you go CAP, you still have to dialyze. I tell you, that is one area you don't want to go there. If you heart disease, you block the heart, then you really no longer function, you die basically. And if you have no feeling, you will basically 30% of the diabetic patient have no sex because they can't feel. And certainly if you are pregnant, you can have gestation diabetic. You thought that I get well, but in about maybe 3-4 years, you become diabetic. So all these complications involve the entire body. So you got to take action. That's why changing lifestyle to help you to prevent all that. Man, if you can do that, you'll be always be healthy. Why not be healthy than rather get all these things? So now we're going to change our subject now to give you catch up. We'll talk about what is colorectal cancer. Okay, it is a very important subject. Now, this is the big, large intestine. Okay, this is how it look like. Now, inside, if you have all these little polyps come up, you got to remove that. But what happens is polyps can they potentially change to cancer. So the cancer, the colorectal cancer can affect in the colon, can also affect the rectum, and basically the entire digestive system can be affected. Now, what it does is start off what they call a polyps. A polyps is a little like a little things that stick out with a little growth of as a little growth of a cells that is grow rapidly, and on top of that is start in your inner wall and start, and then eventually change. Now the cancer that most likely in this area form is called adenomas or hyperplastic polyps, and this is the common one that they have. Now colon cancer is certainly the second leading cause of death worldwide. Is about 10% of cancer cases. This is from WHO. So it's not something is saying that, wow, I don't think I have to worry. It is something to worry. The worst thing is colon cancer, usually you don't feel anything. And you usually detect it only when you're large stage, which means you're stage 4, spread to all the other area, and which is now your treatment will be very, very limited. That's why I want to make sure you get all the webinar early to understand all these cancer, what you need to do. And this is so important. If you know what to do, guess what? You can be safe. If you don't know what to do, wow, that will be terrible. Then you get to stage 4, it's going to be very difficult to treat. So that's why I want to make sure that you understand all this. Now, that's certain risk factor for you, because certainly if you're age over 50 years old, that's why I suggest people over 60 years old, they have to have regular check with the doctor, going to a colonoscopy, maybe first 50 and then 60. Now you find something, they have to check every 5 years. Okay, so that's what you got to do. Age is a factor. So you're age 50, you have to go. Now, some people go as far as 40. If your parents or your family who have cancer before, that's genetic. So family history, if they have, some mom has it or whoever have it, or father has it, you have a higher risk. So you need to check, follow through. Also, lifestyle factors. Now, meaning that, hey, man, I love to eat beef. I eat a lot of red meat. I don't eat fruits. I don't eat salad. Vegetable, forget it. I also very obese. I am, I only sit there to watch TV. I'm a very non-exercise person. I smoke. I drink a lot. Every day, I drink first serve of beer. Now, all that will actually increase your risk of become a potential colon cancer. So you really, in order for you to get a healthy lifestyle, you have to change. And that is something we will talk more about that today. But lifestyle is an important factor, can affect you to get colon cancer. Now, another thing is there are certain polyps which is developed in the colorectal in a chronic situation. So individual, this is all different. So that's why, in order for you to understand, do you have that problem? You have to get the doctor to do a colonoscopy. In other words, a scope go in to go through your rectum and go up to see your large intestine, see any additional polyps. If there are polyps, they have to remove it and check whether there's cancer or not. Okay. Now, the problem with that, majority of colon cancer have no symptom. There are no sign. And in order to check, only you can do that is really go your colonoscopy. So if you are 45 or 40 years old and up, you really need to think about check it every 10 years. Now, you find polyps, they will get you every 5 years. But that is the really typical, because there's no symptom, no stomach pain, no anything. Now, if you have symptom, like for example, you have rectal bleeding, your bowel movement change with diarrhea, constipation, the bowel become narrow, you have anemia, you have abdominal pain, cramp, fatigue and weakness, and then you suddenly have weight loss, meaning lost 30 pounds, for example. All that is actually already in, you have some cancer that is already in a later stage. Now, that's why if you now heard about this webinar, let's work on it to basically take that initiative, talk to the doctor. Hey, doctor, I'm 45 now. Can I have a colonoscopy just to check? May I have that? So I know I don't have colon cancer. Now, after you do that, maybe they say, hey, you're healthy. 10 years later, come back. Or you say, hey, you have polyps. I removed several polyps. I check it. It's still good. But you have to do it every 5 years. So that is something that really the most important, to find out where you are at. And you need to take action immediately to take care of it. Don't wait, okay? Now, you really, at the end of the day, now we have to understand why diabetes and I with so many potentially colon cancer. Now, the real issue is because when you have high blood pressure, high blood sugar, you will have high inflammation because the sugar will continue to go through the blood, and the body said, wow, you know, a lot of sugar, that's mean you must have some kind, either like an infection where somewhere. So you trigger a chain of infection, a chain of reaction in the whole body. You start getting inflammation with all the gut everywhere, especially on the large intestine. And they will start feeling that, wow, is this something here that, you know, some infection. So with the continued hyperglycemia, meaning high blood sugar, your cells are going to start damage. Eventually, all these damage might potentially change the structure of these cells and able to start giving them environment very easy to develop the colorectal cancer. That is how it works, okay? The inflammation is really the key. Now, importantly also, a lot of time when you have chronic stress with the inflammation, the body will continue to get stressed, and then you even further cause more inflamed, because when you stress, more inflamed. Again, you induce more chances for the common cancer start growing. So high blood sugar and inflammation, that is the true link to help you to basically forming this cancer. Now, basically also because of this chronic inflammation, the barrier in the gut make it more, more because of the inflammation, the barrier of gut. The problem is you have all this inflammation, so the gut, all the normal bacteria will be less able to help you to normal flora, help you to digest, but it weaken the wall of the vessels, and those toxins start building up, and then the inflammation of the whole area of the gut actually give them a really good growth, because the inflammation can grow. A lot of sugar stay around there, and then you are giving them the growth of the wall of the gut to give them more abnormal cell to environment for them to grow, so the colorectal cancer will be just easy to build. So net result, the important is the sugar and inflammation. It gives them all that environment to grow their cancer, and that's why it's so important to lower your blood sugar, not to increase your blood sugar and decrease the inflammation. So with that, what is the high risk then, really, at the end of the day? So when you are a diabetic, you can have a risk between 20 to 50% compared to a guy who have no diabetes. So that's high. 20 to 50% of person with diabetes can potentially get colorectal cancer. Now, when you understand that, now you know the reason is because you continue to increase your blood sugar, you continue chronic inflammation because your blood sugar is high, you also are insulin resistant. So the gut bacteria, got a lot of bacteria help you digest it, will be all affected. Oh, net result that, then you have an issue. Definitely it's an issue now, because net result, all these affect the entire, environment, because if your sugar is high, your inflammation, it affects your entire gut environment. It really give the cancer a much more easier way to grow. Okay, now really, if you don't do anything, you will not even know you're colorectal cancer, or you don't even know you're polyp. The only way you can find out is what? You can able to find a colonoscopy examination, which you need to have it. If you and doctor put a scope in there, look at and see any of that polyps they can remove. You can only able to do that is by this procedures, and you have to request the doctor to do it. Now in Hong Kong, it's kind of nice. If you're over 50 years old, matter of fact, health, really the government said, okay, we can help you to sponsor all that. But in other places, United States, if you're age 50 and up, you can actually ask the doctor, make sure to give you that possibility to check. And that is important for you to check, because once you check, you want to find out whether you really have, the coronary polyps, and these polyps will be potentially, the sad part will change to cancer. And that's what we're trying to talk about today, help you to base the early detection, then you don't get into that stage. Now, the thing is, I said, gee, if that's the case, how I'm going to prevent myself to get colorectal cancer? Now, one of the things is very important. You have to change your lifestyle. Lifestyle modification is the key prevention of your colorectal cancer. First thing, you got to have good, balanced diet. What's that mean? You have to basically eat a lot of fruits. If you are only a stick potato, no fruit, you have a good chance to really get colorectal cancer. You really got to start changing it. Hey, I need to get a lot of fruits. I need to get a vegetable, which is colorful vegetable with a lot of lettuce, a lot of fibers, tomatoes, carrots, whatever in there. I have whole grain. I have to eat lean protein, not in the sense of all the red meat. Limited red meat. Matter of fact, try not to eat too much red meat, more fish, also processed food, and don't drink a lot of sugar drinks like bubble tea. Oh, take that out, man. That is really terrible for you, because that every tea with 300 to 400 carbs for you, grams of carbs from you, which you don't want to do that. You really want to eliminate all that sugar. And then you also drink low sugar tea with at least 2 glasses per meal, 4 times a day. So you 8 glasses a day. That will help you to lower your blood sugar, lower your cholesterol, lower your blood pressure. You got to do that. Now, you also need to manage your stress. Stress leads to all hormonal changes, increase your cortisol, go up, adrenaline goes up, and all that. When you have all the adrenaline goes up, you know what? It causes inflammation. The inflammation is the condition, remember, it helps you to really grow your cancer. So you don't want that inflammation. So you have to relax, ensure you enough sleep, make sure that you have good sleep, be well-being, then you are in good shape. Because if you continue stress, you have all kind of problems goes up. Besides cancer, you also have heart condition, high blood pressure, blood sugar goes up. Not good for you. So you got to really, at the end of the day, continue stress to get you to really lower your blood, your stress, and then so you don't get all the inflammation, sugar goes up. A lot of people don't realize exercise help you. You have to do a regular exercise. What that mean? That mean every day I will have to walk 10,000 steps. Wow, is that a lot? Not really, because I just recently with a bunch of elderly folks, which is 60, 70 years old already. And I said, hey, can you do 10,000 steps? And at first they said, no, I cannot do this. But I introduced them to say, hey, why don't you go walk around shopping mall? Every day, just after dinner, take a husband to go there walk, or take a wife to go there. So they start trying it out. At first, they tried 3,000 steps. They said, oh, I'm getting tired. They get up to 5,000 steps. Oh, I'm still getting tired. But eventually moved themselves to what? 10,000 steps. So after about 4 or 5 months, I said, hey, have you done your 10,000 steps? You know what they tell me? Oh, this is really good because every day I go to shopping mall, I see new thing, I enjoy the music, I'm air conditioned. And if you're in Hawaii, you walk down Alamon Shopping Center, you walk around and you have enjoy all the new design of the all the fashion, whatever. You don't have to buy anything. But because that was already 6, 7, 8 years, 8 times. So you don't have to buy, just walk and enjoy. Enjoy all the people, seeing all the people. At the end of the day, you're going to have a lot of good exercise. Now, certainly, you can do also aerobic exercise or weightlifting. Basically, you have a barbell. Very easy to go up and down this arm, go up and down this arm, and then you can have a step master. And you can able to do that. The step master costs only $50 US. In Hong Kong, only $300. So net result, you can do the same thing. Or if you live in an apartment, you walk up the stair, you live in 20th floor, I get up at 10th floor, walk up to the rest of the 10th floor, you can do that. So it's all kind of way to help you walk up is better walk down because it doesn't impact your knee as much. Now, if you're a smoker, you got to decrease that risk of develop diabetic. You really just got to stop smoking. Quit, man, because that would damage your lung. You don't want to get yourself lung cancer. You would improve, increase your chance of colorectal cancer, and you get your diabetes get worse. So you smoke, quit. That's it. Just quit. Not say I smoke less. Quit. Now, last but not least, you have to manage your weight. Now, why weight is so important? Because if you are already 330 BMI, if you minus 10% of that weight, meaning that I am 225 pounds, if I get myself to 200 pounds, your A1C is minus 1 point, meaning that if I'm 8, I will become 7. If I'm 7, I'm going to 6. So that is so important. And you have to continue to monitor that, continue to manage your weight, make sure your weight continue to go down. Get your BMI all the way to 23. Now, that all take effort. It's not given. In other words, you don't just come, I get that. No, you have to work on it, unfortunately, my friend. Like all these friends that are listening to our program now, they wake up at 5 o'clock, they walk 1 hour at the park at Kapiolani Park, go around, and you know what? They got the exercise. They keep up their weight. The blood sugar improve. If they don't walk, the blood sugar go up. And you don't drink no shooty, the blood sugar goes up. That's simple. So you really have to work on this. Now, on top of that, you have to measure yourself. Are you reaching those goals? In other words, every day you have to make sure you measure blood sugar, or you use one of these things called Abbott Libby. If you have one of these, and that is important because it tell you how well are you doing your blood sugar. It's no pain, and you gotta go to your doctor office to say, hey, what is the HbA1c? If your HbA1c is 6.4, you are in much better shape. Don't think that your A1C is 7 is good. It's not good yet. You have to bring it to 6.4. And then you have to go to colorectal cancer screening. Like, for example, every 10 years, you have to do one. And then you have to basically also do your stool test and then see whether your colon, scope to see if you have any polyps. You also, a stool test can ask you early stage to see that do you have cancer in there too. That was a stool test screening. So those are the good, important stuff you have to do. Now, so we have talked a lot about you got to drink low sugar tea, how it can help you, because low sugar truly can help you lower your 3 high. And that is so important because you lower your blood sugar, bad cholesterol, which is the LDL cholesterol, and also blood pressure. Now, very important because this is not a drug. It's only a food. You have medication, you can still drink low sugar tea. It doesn't matter because it won't contraindication to your medication. It is only a food. And that this can give you at least lower your blood sugar, lower cholesterol, plus adding your exercise and all that good stuff that you have, you will actually get better healthy. And that result, you can able to be a healthier person, eliminate your chance to get colorectal cancer, and you can see your grandchildren. And you are not going to get yourself all complicated after chemotherapy, after surgery. When you get down to stage 3 or stage 2, those are things that you're going to end up to doing it if you don't treat. And if you treatment, then you have all kinds of these problems coming up. So you mess up, don't even get to those stage. So start now, act now to basically change your lifestyle. With that, if you change your lifestyle, chances or you get colorectal cancer will be much less. And do the examination to able to help you to basically to check whether you have, if you have cut it, the polyps, make sure that you can remove so the polyps will not continue to grow to be a cancer, right? So now you understand the diabetes linking colorectal cancer, you need to take action. The reason is because the high chronic inflammation because of blood sugar can go up. So you know that is really trigger a potential environment for your colorectal cancer to grow. Now you have to detect that was really mainly by understanding one, your risk, your age, your genetic, make sure you don't have that. And then you basically able to ask your doctor to give you a colonoscopy examination to see all your whole gut, anything that is have polyps there, so you can remove it. And then last but not least, you really have to change your lifestyle, meaning that you have to eat healthy, quit smoking. Healthy, what's that mean? You have a lot of vegetable, you have to a lot of fruits, you have to cut off your red meat or very, very little red meat, but all more on the lean protein, more fish to help you to do that. Then you have to do exercise. And net result, your exercise will reduce your stress, reduce your blood sugar and all the cholesterol. And on top of that, you need to start looking for any common symptom potential look like that. Wow, you know, really at the end of the day, is that an issue? So after a screening, you have to keep going back. In other words, you do the first 10 years, doesn't mean that you have to go back after the next 10 years. Now, if you find polyps, it will be every 5 years. So net result, you now basically have a pretty good screening and protect yourself. The important thing is changing your lifestyle. Don't get a lot of alcohol drink, quit smoking, eat diet, good diet, lower your weight, and also uh, uh, you know make sure that you continue to exercise. So net result, if you can change lifestyle, formulate a habit, wow, you are going to be so much better. You'll be healthy. You can see your grandchildren all the time down the road. You'll be super, super good. So today, this is my lecture, and I hope that I could answer a question for you if you need to, or write to me, Andy at wahfong.com, ANDY at WAHFONG.com. Or you can WhatsApp us, is 852-6792, no, 852, and WhatsApp number is 6792-8891. 852 is the area code, 6792-8891. You can always WhatsApp it. Actually, a lot of people write to me my email by Andy at wahfong.com, ANDY at WAHFONG.com. Lots of people write to me, and then also a lot of people wrote to me on the comments of they really like the cancer lecture to help them, to alert them. I hope you can really take action and act. So do write to me, and we can help you to answer questions, and hopefully that you are continue alert. Now, today's lecture is just an eye-opener for you. You need to act, my friend. You need to go actually take action. And you have not done a colonoscopy, you might need to ask the doctor, can I have one? And on top of that, if your lifestyle is not really what I talk about, you need to start changing that lifestyle. I think if you do that, you find yourself much more healthier, you're much more happier, and on top of that, you end up can see your grandchildren and so happy, man. I really want you to see when you're 89 years old, see our grandchildren graduate instead of sitting in a bed. Oh man, I'm sick. I have cancer. I don't want you to do that. And so let's change that. And you will basically, if you take action, I'm sure you can be healthy. You can do it. All right. Any questions? Okay. If no question, I thank you very much. I wish you have a wonderful weekend. I hope that you can able to real healthy, and thank you watching for my webinar. I appreciate it. And so at the end of the day, I'll see you next week. We'll have another series of cancer for people who have high blood sugar, that cancer related to them. Okay. Thank you again. If there are no questions, I appreciate you attend. I'm looking forward to work with you again, and have a nice weekend. Thank you very much. Bye-bye.